Okay, I don't know if you all heard the question, but the question was, why does Lyme disease hurt? And that's an interesting question. I don't think a lot of people know um, much about Lyme disease, except it's transmitted by a deer tick, at least from our earlier discussion groups. Lyme disease was first recognized, I think, around 1975. It comes from Lyme, Connecticut, and where a large number of children were being diagnosed with juvenile rheumatoid arthritis. Juvenile rheumatoid arthritis. Pain in the joints is what led people to investigate. They found out that most of the children lived near wooded areas that harbored deer ticks. They found that the children's first symptoms were usually around the time of the height of tick season, and also they had a peculiar skin rash, if I say it wrong, erythema migrans, which is a circular, triangular, oval-shaped rash. When I've seen it, it's been circular. It kind of looks like a bullseye. And they found out that they got this rash just before developing the arthritis. And many of the people knew that they had been bit by a tick in that same area. So, long story short, they found out it was a bacterium or spirochete named Borrelia. It's a spiral-shaped bacterium, and it comes off of deer ticks. Now, what a lot of people don't understand is Lyme disease is all over the place. It is in the coastal northeast, the mid-Atlantic states, Wisconsin, Minnesota, Northern California. It's found in Asia, Europe, South America. Well, it's not just in the Connecticut area, okay? It's much more prevalent than we thought it was. There's been some people thought it was not very prevalent, then they thought it was, and then back and forth. Well, now we know pretty much there's a lot more out there than we thought. There's a lot more problems than most people realize occur with Lyme disease. And to answer the question, why does it hurt? Because the first symptoms in a lot of people are arthritis. And people that are not treated appropriately with antibiotics quickly develop recurrent attacks of painful swollen joints. And the arthritis can shift from joint to joint and affect multiple joints. The knuckle joints are really the only one that's not rarely affected. But also, people don't seem to know that neurological symptoms can be a major problem. I think neuropathy, there's people that differ with me, but stiff neck, severe headaches, meningitis, Bell's palsy, paralysis of the facial muscles can occur, which is a direct mononeuropathy, numbness and pain, poor coordination. There's subtle changes like memory loss, concentration problems, attention problems, mood problems, sleeping habits problems, lots of neurological symptoms. And these usually develop a little later following untreated infections or treated infections. So the neurological disease can see people return to normal function when treated, but not with everybody. There's also heart problems. It's not common, but it's about 1 in 10. And also you can have symptomology like dizziness and shortness of breath. But, Lyme disease is one of those other disorders that inflammation occurs, and in the whole body you see inflammation. And as we know, as we've discussed, inflammation can cause aging, it causes increased cytokines, it causes aching, it causes all kinds of bad problems, and it affects the whole body. So starting this inflammatory cascade is very problematic, and Lyme's disease is a really significant disorder, and it can be very painful. both when I've seen it in both joints and in the nerves. So I hope that answered your question. We'll go